Today, we're going to be discussing Community Central Health's response to COVID-19, and this will include conversations about the COVID-19 hotline, drive-up testing and expanded testing sites, medical appointments by phone or telehealth, pharmacy, health coverage options for people who are uninsured, including MAP and MAP Basic, and then other items that may come up during the conversation. Again, as we begin, please mute yourself, and we will have time for questions at the end. If you're on the phone, you press star 69 to unmute yourself. With that, let me introduce our guest. We have Mike Giesland, President and CEO of Central Health. From Community Care, we have Matt Balthazar. He's the Vice President of Health Center Advancement at Community Care. And then we have Tiara Thomas, the Chief Operations Officer for Sendero Health Plans. So quickly, let me just lay the foundation. More than 161,000 Travis County residents have no health insurance. And these are the people that Central Health and the Central Health Enterprise is committed to caring for. And we know that number is likely to grow as a result of the COVID-19 situation. Central Health is Travis County's healthcare district, and our mission has never been more critical than it is during the COVID-19 pandemic. By caring for those who need it most, Central Health improves the health of our community. Now, the Central Health Enterprise includes Community Care Health Centers and Sendero Health Plans, our nonprofit, community-based health insurance company. We have about 1,200, that's 1,200 dedicated staff working to keep the people that we serve and the people that serve them safe as we work together to flatten the curve and stop the spread of COVID-19. And we'll talk about that today. Now, although the Central Health Enterprise, which is Community Care and Sendero, is working together collectively, we've also been working very closely with Austin public health officials, Travis County public health officials. And remember that Austin Public Health is our local public health authority. And so we are in constant contact with them and their emergency operations center. That's daily contact. So for the very latest news on COVID-19 in our community, please go to the Austin Public Health website, which is austintexas.gov/COVID-19, or you could just Google Austin Public Health COVID-19. And that's where you'll find the latest information about COVID exposures, COVID fatalities, and also very helpful information about protection, prevention, etc. We will talk later in this conversation about the resources that Central Health and Community Care have made available. And this includes a lot of information on our website and social media posts that we would welcome you to use and share. And we will also talk about what we've been doing to reach out to our residents, the people that we serve. And then, of course, if you have suggestions or questions, we want to hear from that as well. Well, let's start the conversation. As you know, like communities around the country, Travis County is working to flatten the curve and stop the spread of COVID-19. Here and in other communities impacted by COVID-19, resources like testing and access to personal protective equipment for staff has been limited. And Mike, if you would unmute, could you please talk about how these limitations have factored into some very challenging operational decisions by Central Health and Community Care?
Yes, thank you. And first I want to thank everybody for joining us online.
Mike, can you unmute?
I am unmuted.
Go ahead.
Can you hear me okay?
I can, thank you.
Okay. So I want to thank everybody for joining us today. I know typically we like to do these in person, but given the circumstances, we appreciate everybody accommodating this and making this part of your day. This is important information that we have to share with you. So, first I just want to cut to the chase and talk about the temporary clinic closures. There were some single provider clinics, and these are typically in smaller buildings or mobile units. And the decision was made to temporarily close and consolidate the operations with other clinic sites for a number of reasons. There's two that I'll focus on. One is the conservation of the personal protective equipment that's necessary in accordance with the Center for Disease Control Guidelines, which is a federal agency, but also in complying with the local authority orders to really encourage social distancing and to keep people safe and healthy in these smaller facilities. It's difficult to be able to maintain that space. And that is not only for the benefit of the patients that are there, but also the people that they in turn come into contact with, and those providers that in turn come in contact with other people and other patients. And so we didn't want, in addition to the personal protective equipment issue, we didn't want these smaller facilities turning into hotspots that ultimately exacerbate the spread of COVID-19. Now, let's look at the obvious here. It's these facilities, although there's one in far reaches of western Travis County near Jonestown that I heard about, but the rest of these were all in what we call the Eastern Crescent, in east of 183, in some instances for the Creedmoor, in Austin's Colony, Hornsby Bend, Colony Park. If I'm leaving out a location, please forgive me, but these particular facilities, whether it's the mobile facility or the modular units that we installed, such as we did in Hornsby Bend, these were temporary solutions that were set up starting a couple of years ago, most recently this March when we had the formal opening of, February, the formal opening of Austin Colony, Hornsby Bend. These were all short-term solutions. These were temporary solutions for those communities, and they were not set up or established to provide care during pandemic emergencies where you had restricted supplies and local orders encouraging social distancing. So there's a number of complicating factors, but suffice to say, these were very difficult decisions that were made. They were made with patient safety in mind. And, if there's anything we could do to fast forward and get to the solutions that we are currently working on and still working on for the longer term health and wellness centers for some of these areas, we wouldn't be having this conversation, but nonetheless, we are where we are. And while this was a difficult decision, we're going to continue to do everything we can to connect people with care. And you'll hear more about that in this conversation through our telehealth, but also looking at alternative testing sites in areas in Eastern Travis County so we can increase the testing that we're doing. So that's one example of a very difficult decision that we had to make and the set of circumstances. And, I fully understand and appreciate, and I've heard from a number of you, and I really appreciate you all reaching out to me. But I appreciate the sentiments and the feelings that people have, which is, we just got these facilities and now they've been taken away. And let me just emphasize that these are, it's not something that we wanted to do, but in light of the situation and patient safety, it was the best decision at the time. And we're going to continue to look at this situation. And as soon as we can bring these clinics online, we're certainly going to do that.
Matt, can you talk a little bit about some of the the strategies that Community Care is pursuing to keep access to care possible for people all over the county, specifically regarding medical appointments by phone?
Central Health for hosting this. It's really great to see everyone's face. Haven't seen a lot of folks in a while, so really appreciate seeing everyone together. So thank you for hosting this for us. Ted, to your question about telemedicine, we are converting the vast majority of our appointments to telephonic appointments. So right now, those are about 80%. And the intention behind this and the goal behind this is twofold. One, we want to make sure that we're continuing to provide access for folks who need it. But we want to make sure that we're doing that in the safest way possible for our staff, as well as for the patients who are seeking care. So if there are things that we can take care of via the telephone, we want to make sure that we're addressing the needs in that way. Because right now, the message that you're hearing from local public health authorities, from us, from people across the country is we want folks to stay home and we want folks to stay safe. And so if we can provide medical appointments from the comfort and safety of someone's home, then we want to make sure that we're doing that. That limits the exposure from patients to patient interaction, as well as patient to staff interaction. And the other thing that it does is it really helps with the preservation of personal protection equipment. As you heard Mike mention, that's one of the main drivers in us being able to provide service in the way that we are. And our ability to conserve PPE means that we're able to continue to do things like the drive-through testing site, continue to provide in-person visits at our locations, et cetera. So we want to shift as much as we can to telemedicine. One of the kind of anecdotally what we're hearing from our teams as well as our patients is that while it's unique and while it's different than what we thought we were going to be doing, 4 weeks ago before all of this really took hold, is we're seeing folks be very receptive to it. And so they don't have to battle things like transportation. They don't have to worry as much about things such as childcare, et cetera, if they're able to stay at home and get their needs met telephonically.
So Matt, two things I want to ask you about. First of all, I want to go back to the clinic consolidation. These are temporary closings, correct? And can you talk about the process for reopening the clinics? What will be required to get them back on in regards to PPE, personal protective equipment, testing, et cetera? And then we're going to come back and talk more about telemedicine or medical appointments by phone.
Sure. So Ted, the main driver for us in being able to bring these back online is the availability of PPE. Right now, we are hopeful that we're starting to see a trickle of personal protective equipment come in. To what extent and what threshold that has to hit before we're able to bring these sites back online is something that we're working through currently. So I don't have specific numbers or details to give, but it's based on our availability of PPE. And as that continues to trickle in, as we're able to get the equipment necessary to keep our staff and our patients safe, we will absolutely be considering bringing those sites online.
And it's not just community care. I've read that Baylor Scott & White has closed facilities in other parts of the county. So this is a local, state, and national strategy to conserve PPE and to protect patients and staff. Is that correct?
Yes, I don't know the specifics of those other systems that you referenced, but yes, you're hearing this across the country. And as folks, because we have to screen, one of the pieces that is included in all of this is we have to screen folks coming into our facilities to see if they're symptomatic. And so our folks standing out front are donning full personal protective equipment. And in smaller sites, that's difficult to have one individual out there while at the same time continue operations and then look at isolation procedures if someone does have suspected COVID.
Can we talk about, and I'm sure we'll have questions about that, and I know we'll come back to it, but talking about medical appointments by phone, can you explain exactly how that's working or how it works? So if you're a community care patient and you need to see your provider, tell me how, or tell our participants how exactly this works.
Sure. So there's a couple ways for patients to be able to access medical care telephonically. The primary way is through our main call center, the 512-978-9015 number. They call that number and they explain to the patient service representative what they're experiencing, and that patient service representative then will schedule an appointment. And what that does is it allows them to have a scheduled time slot that works for them and works for the care team to be able to then call them back. So at the time of their appointment, the medical assistant will call the patient. They will connect via the phone and go through very similarly like you would in person, with the only exception being we're not able to do kind of hands-on vitals, but they'll ask all of the same questions of what are your symptoms, what are you experiencing, have you had a fever, what has that fever been, et cetera. to be able to gather all of that information, and then they'll then connect that patient to the provider. And then the provider will go through their telephonic visit just as they would in an in-person, face-to-face conversation. So it's very similar to what you would experience walking into the doctor's office normally. The only difference is you're not seeing someone face-to-face, you're having this communication over the phone.
I appreciate that. I think we may have more questions regarding that as well, but just to wrap that piece up, are there certain types of appointments that are best suited for telephone appointments?
What we're seeing is a lot of visits are able to be accomplished telephonically, such as chronic disease management, people with diabetes, high blood pressure, and even some acute conditions are able to be addressed telephonically. Those that may require lab work or things such as preventative visits where you really do need a hands-on physical exam, those are not as well suited for the phone, but a good number of other conditions are absolutely treatable over the phone.
I just want to repeat the phone number that you mentioned. If somebody wants to, if a community care patient needs to schedule an appointment, they should call 512-978-9015. And if you need to find more information, you can go to our website, centralhealth.net, and find that information as well. And then one other question regarding medical needs by phone. Will you talk about how people can get prescriptions mailed to their home and explain how that's working?
Sure. So similarly, in the way that we've converted, we've tried to limit patient and staff and patient interactions in person on the medical side. We've also wanted to do the same at our pharmacies. So our pharmacy team has been working diligently, and they've set up a system in which patients can have prescriptions mailed to their home. If patients are interested in doing that, they can set that up by calling the pharmacy hotline. That number is 512-978-8139. And this mailing of prescriptions is a free service that we're providing to all patients. The other alternative to having prescription mailed to them is we're doing curbside pickup, similar to what you see at restaurants doing and other things. Again, limiting people needing to come into the building. They can drive up to the Central Health Southeast Health and Wellness Center on Montopolis Drive, and also at our David Powell Pharmacy, they can do drive-through prescriptions there. So we've got a couple different options that help people get the prescriptions that they need while at the same time limiting the need for face-to-face interaction.
Good. I want to bring Mike back into the conversation, and Thomas with Sendero is here as well. Well, let's move on and talk about testing. So there is a COVID-19 hotline, which Community Care launched several weeks ago, and we will repeat these numbers throughout this call and make them readily available. They are available on both the Community Care website and Central Health website. But the COVID-19 hotline number is 512-978-8775. 512-978-8775. And can you and Mike talk about the hotline, the purpose of the hotline, and then how people can get tested?
Sure. Mike, you want me to
Yeah, I'll chime in first, and then
Okay.
if there's any detail that I left out, please provide. So this hotline, as Ted mentioned, was opened up in mid-March, and it was for people that believed that they had coronavirus or coronavirus-like symptoms. And the idea was to have a first stop so that people wouldn't have to go directly into the clinics or an urgent care center or any of the emergency departments. And by calling this hotline, you had the opportunity to speak to someone and then decide, do we need to go in and be tested or not? And there's a set of criteria that I'll let Matt walk through that was used to determine whether or not to direct somebody to the drive-up testing site, depending on what their symptoms were. Matt?
And I also want to point out, please, let's keep reminding people that the testing is free. And through the hotline and the testing site that Matt's going to talk about, this is currently the only testing site in Travis County for everybody without an appointment. No insurance, no way to pay for it, no doctor, no appointment. You can still get tested, Matt. I'll let you take it from there.
Yes, that's exactly right. We're community facing, and so what that means is it's drive-through without an appointment. We do have the drive-through testing and the hotline work hand in hand, because a good number of folks that we talk to through the hotline, if they're experiencing any type of what we're calling kind of the big three symptoms of COVID, which is fever, cough, or shortness of breath, then we are recommending that they go through our drive-through testing site. The testing, it's evolved over the times that we've stood it up based on the availability of tests. And so it started where we had to have a confirmed exposure to COVID in order to qualify for testing, but we go through a screening process at the site. As tests have become more available within the community, we've been able to expand that to folks who are experiencing the symptoms that I mentioned. And so this is at our Hancock Center, which is at 41st Street and I-35. Once they drive up, they'll interact with our nursing team, who ask them a series of questions to best direct them to the appropriate lane, if you will. And then if they're experiencing COVID-like symptoms, or if they have known exposure, then they will qualify for testing, and they'll be able to stay and remain in their cars and then be tested directly through that drive-through process.
And these guidelines regarding testing, these come from the federal government. So from the U.S., the CDC, Centers for Disease Control and Prevention. So those are their guidelines that you're following. I also want to emphasize that the Hancock drive-up testing site is open 7 days a week. And again, you don't need an appointment, although I think what I'm hearing from you is you prefer people to call the hotline first just to get a pre-screen over the phone, but it's not mandatory. Is that correct?
Either option is fine. One of the benefits of calling the hotline is that you can get, we get a lot of calls that are about education only, maybe people who are asymptomatic but are concerned for themselves or a loved one, and we're able to handle that over the phone rather than someone needing to go in person to Hancock to get that education.
So can we talk about expanding the drive-up testing sites and what community care is planning for the future, I believe as early as next week?
Sure. So we're looking at how do we expand our testing locations. Right now, we're just at the Hancock location. We're looking at how do we bring this same service into some of our more remote communities that we know have needs to be able to access testing. And so we're looking at areas such as Hornsby Bend, such as Colony Park, such as Del Valley, such as Dove Springs, and our teams are actively working on what that schedule would look like. Where staffing, what staffing we would have in place to be able to do that, how we would be able to refrigerate the medium that's used in the testing. So some of the logistics are still being worked out, but those are communities we're actively looking at how do we get testing to, and standing up another team that will rotate amongst the Eastern Crescent.
And so would you use the mobile unit to then that becomes the anchor for a drive-up testing site? Can you explain how that would work?
Yes, and I think we're still trying to determine what is the best way to do that. Do we use the mobile unit? It has a refrigerator on board. It has all of the supplies. We could pull that up. You know, you need a lot of space to be able to drive through. So a space that we're looking, or spaces that we're looking for, would need to accommodate the ability for drive-through. We're also looking at do we have the ability to do something with a lighter footprint? So not necessarily the mobile unit, but could we use generators and refrigerators and tents to be able to do this as well? So the logistics, like I said, we've got a team that's actively working on that to figure out how is the best way to do this in the most effective way possible. But hopefully we'll have more details coming shortly.
Okay. And a question, if somebody doesn't have transportation, I know we keep talking about drive-up testing. Is there a way to accommodate somebody who doesn't necessarily have a car and arrives in a vehicle? Have you guys had that situation yet at the Hancock location?
You know, that's a question that I'm sure our team has faced. I'm not aware of what we've done in that scenario, but that's a question I can get an answer to and get back to this group.
Okay, perfect. Thank you. I know we're going to have more questions about drive-up testing. We're also receiving questions via the chat, and we're going to get to as many of those as we can. And also, if you're on the phone, we will open up the phone lines for questions in just a few minutes. But I do want to bring Tiara Thomas with Sendero into our conversation. As you may or may not know, Sendero is Central Health's nonprofit health insurance company, and they have been our partner. We've all been partnering together during this COVID response. But Tiara, could you talk a little bit about what Sendero is doing and has been doing to assist your members during this COVID pandemic? Tiara? There you are. Hi
Can
there.
you hear me?
Yeah, I can hear you. Thank you so much.
Okay. Sendero is one of the few health plans that we're able to waive the cost for treatment and for testing for all of our members. As the pandemic has started to worsen, Sendero contacted over 500 of the low-income chronically ill patients or members to us that were formerly a part of the Central Health Medical Access Program. We called these members to remind them and explain to them how they could protect themselves, what to do if they believe they have symptoms, and where to go for testing. We are also offering free mail order or 90-day delivery service for maintenance medications to our members as well.
Just to confirm what I heard, free testing and free treatment for Sendero members using in-network providers. Is that correct?
That is correct.
Okay. And then I know yesterday you and I talked a little bit about emotional and mental health services, which are part of the healthcare service system. But can you talk about what Sendero is doing and then some other resources that people may need? And I want to remind people that are on the call, whether you're video conferencing or on the phone, all of this information is available at centralhealth.net, and you start from the homepage. If you want us to email it to you or talk on the phone, we'd be happy to walk you through this as well. But could you touch on that, please, Tiara?
Yes. In addition to waiving the COVID-19 testing and treatment costs, Sendero, we are reminding our members of the 24/7 telemedicine services that they've been having as a benefit to them over the past years, and the nurse advice line. Our nurse advice line number is 855-880-7019, and we're also encouraging members to call us if they need any additional assistance or resources. As it relates to emotional and mental health services, the Texas Health and Human Services has launched a 24/7 statewide mental health support line to help Texans experiencing anxiety, stress, or emotional challenges due to the COVID-19 pandemic. This is a new resource for COVID-19 related mental health support for Texans. People can call statewide 24/7, 24 hours a day, 7 days a week at 833-986-1919. And Sendero members also have access to mental health crisis line, which is also available 24/7. That number is 855-765-9696.
So, Tiara, for your members, for Sendero members, what's the main message that you want them to get? And if there's one number they should know to call, what would that be?
That number would be our customer service department. If members do not have access to telemedicine, our customer service department can walk them through the process. Again, they've had access to telemedicine over the years. So those that aren't actively using telemedicine, they can call our customer service department at 844-800-4693.
Okay, thank you. I would like to move on, but continue talking about health coverage. And Mike, or everybody I think knows that COVID-19 has resulted in an extremely high number of people losing their jobs, losing their health coverage, losing their income. Can we talk about health coverage options for Travis County residents with low income before, during, or after the COVID-19 pandemic?
Yes, absolutely. So if you've, lost your employment or there's any change in your situation that you've seen a reduction in income, and obviously healthcare is a concern to all of us, we really want to encourage you to reach out to us. I know we're providing a lot of phone numbers today, and as Ted said, we'll post these so you don't have to remember them or write them down. But I want to encourage people to call 512-978-8130, and we have staff, bilingual staff that can assist individuals with navigating all these different healthcare coverage options. What we will work with people on is providing assistance in making application for the Medical Access Program, also known as MAP, or the Medical Access Basic Program, or MAP Basic, which is the sliding fee scale program for people that make a little bit more money such that they can't qualify for MAP. We'll also help them out with Medicaid and Children's Health Insurance Plans, or CHIP. And in light of the COVID crisis, everyone, we've been able to pivot and do all this completely on a remote basis, meaning you don't have to have in-person appointments. You can do this over the phone. We work with people via email. We do arrange for, if you don't have access because of digital divide to computers or faxes, we have ways to arrange document drop-offs. And we don't want anybody that is eligible for MAP or MAP Basic or these other programs to go without it. So we will work with you in finding a way to get you enrolled. This is so important. And even if you are not in a situation where you need to apply for MAP or MAP Basic or these other programs, you might know somebody. And so please direct them back to our website. If they don't have access to a computer, pick up the phone and call them, or call one of us so that we can do an outbound call to make sure people are connected to these resources. And I'll also say that, as we're working through this, there's a number of resources, and Tara touched on them, that because of the Affordable Care Act, that you would have access to also purchase health insurance as well.
Thank you, Mike. We want to try to start answering some questions. We have a number that have been asked via the chat function, and we're answering some of those online. And I know I can't get to all of them, and so we're going to attempt to answer some of them. And again, I want to thank everybody for joining. This is our first attempt at this. We know it's not perfect, and there will be ways to improve it. And so, and we would love to hear from you as to how we can make it more useful and more meaningful. Thank you for that. A couple of questions that have come up. One is regarding PPE. This is probably a Matt question. I don't want to say personal protective equipment. Matt, do you have any idea on when those numbers will go up and any other dependencies that would prevent clinics from reopening?
As I mentioned, we're starting to get a little bit of a trickle on masks. So the limiting factor for us is the N95 masks, as well as our barrier surgical masks. Everything with gloves, gowns, eye protection, we seem to be at a pretty good state at, but it's really the limitation is with the masks themselves. Those are starting to come in. We get a few here and a few there. Our purchasing teams are working diligently and beating the bushes. But if anyone has a line on N95 masks or surgical masks, we'd be happy to take those donations as well. So that's where it's a little hard to put together a timing, Ted. We're looking at what is that criteria? How many days do we need to get to? Because part of this is this can change rapidly. So while we may have adequate supply of PPE to maintain status quo today, should there be greater incidents within our community, that may, and our demands for PPE may change. So I don't have the specific threshold to give folks right now, but that's something we're trying to put together.
Another question, a couple of quick questions. One question is, can uninsured people in Williamson County access testing through community care? So can they come for now to the Hancock Center or to these other drive-up locations when those start next week?
Right now, we're not turning anyone away based on where they live or insurance status.
Okay. And then there was a question regarding specialty care. Is specialty care also being conducted over the phone, medical appointments by phone?
Yes, depending on the specialty, some are more suited for telemedicine than others. But yes, they're trying to do as much care, including specialty care, via telephone as possible.
Okay. I think we're going to attempt, we have more questions in writing. We're going to try to come back to those. And I also want to say that we're going to compile all the questions that we're receiving with answers and make those available. If you go to centralhealth.net, we have a email distribution list that you can sign up for, where we send out regular communications, e-newsletters, updates, that sort of thing. And so that is available for everybody. We would love for you to join. And now I'm going to ask Mike McKinnon, are we going to try to take questions from callers? And they would need to hit *69 to unmute their phone. And if you would like, just identify yourself. So we're going to try this.
Yeah, we can try it. I'm not sure who our actual moderator is. I suppose we can just try to be civil about it.
I think there's a call.
Hi, this is Fatima. Can you hear me?
You. Yes.
Awesome.
Yes.
I hope you're all drinking water, taking care of yourselves. Thank you for this call. This is amazing. A question in regarding the some of the clinics and spaces that have been closed. Has there been any talks around allowing them to be open for mothers or for women who are having babies, prenatal, postnatal care, especially for moms who are underserviced and don't have insurance and or are all at risk of all the things? Has there been a talk about converting them to specifically birthing centers for non-COVID moms, or even possibly one for COVID moms? But either way, mothers are still having babies, and women who don't have access to resources and funding are really at risk right now. So I didn't know if there was any conversations about alternative birthing centers and how these clinics could service them.
I think that's probably, Matt, did you hear the question? Okay, go ahead, sorry.
Yes, I did. So we have converted our East Austin location into, right now it's OB only, recognizing that we want to make sure that we're providing the safest environment for women who continue to need to be seen for prenatal care, as you mentioned. Want to make sure that we're providing an environment that is the safest way possible. We have been able to convert a handful of our OB appointments in the series to telephonic visits, but there is still a need to maintain a few of those as in-person visits as well. So we've done that with our East Austin location. We haven't had future conversations beyond East Austin, Southeast, and North Central as areas, and Austin OB-GYN Bastrop. Those are the 4 locations where we're continuing to provide OB care, but we haven't had conversations beyond that. In terms of your question about birthing centers, that's not something that falls within the CUC scope, and I'm not aware of what conversations our delivering partners at Ascension or St. David's have had in terms of alternative birthing locations.
Hey, Ted, this is Mike, and thank you for the question on the birthing centers. What we'll do is reach out to some of our partners and contacts that we know to try to get as much information on that as we can in light of the response. But I want to make sure that I heard your question. Could you restate the question on the birthing centers? I want to make sure I captured it.
Yes. Has there been there's a need for birthing centers so mothers don't have to go to the hospital, right?
Right.
A lot of moms are afraid. So is there any way that medical clinics can be, or places that have been closed, can they be converted into actual birthing centers?
Yes. So I'll tell you what we'll do. We'll ask to see if we can get a quick answer to your question, but the other commitment that I'll make to you is here in about 15 minutes, I've got to jump on a regional healthcare call, and I will bring this up to find out, is there anything that we can do in light of the hospital situation around birthing centers? I think it's an excellent question.
Thank you so much.
Questions in the chat, but is there anybody else on the phone that would like to ask a question? *69 to ask a question. Anybody, any caller with a question? Because we do have more in our chat feature. Debbie, go ahead.
Yeah, hi, everybody. I'm Debbie Locklear. I'm a community care board member. Mine is more of a statement, well, sort of a question. How can we, I don't know. I mean, actually, we're going to have to protect ourselves even more because there's several people that I have shared with that really not concerned about COVID-19. It's like, well, there was H1N1, Ebola, and all that stuff. I'm gonna catch it. I'm gonna catch it. It's like, well, what about others? Think about others. Anyway, I don't know if y'all heard it. There was a lady. It was in another state. She was coughing on the bus. She wasn't, covering her mouth, and the bus operator kept calling in for a couple of weeks. Anyway, he ended up catching the virus. I mean, he could have got it from somewhere else, but anyway, it's a madhouse.
Yeah.
And he did die.
Yes.
So that's
Debbie,
that's another issue, biggie issue.
Yeah.
Anyway.
Okay.
Debbie, that's
get back to some real issues. This is Richard Franklin. I just want to make an observation before asking a question. You instantly, upon realizing this thing was going to be out of hand, the first thing you did was retreat from the people who needed the most. And with the light of what's happening to African Americans across the country right now, the very first thing that happened was you took the resources, the little resources that were applied to an area that has a heavy African American population, and withdrew them to an area not where heavy occupation of African Americans is. And the most vulnerable population right now are people of color, and you have nothing for them right now. Not next week, not planning for, not something else. You have nothing planned for right now. So the question is, how fast can you get it to the people who are going to suffer? Because you're going to have people in their homes dying. You're going to find dead bodies in this month after this thing is all over with, if you don't get some help to here right now, and the blood is going to be on your hands. So how fast is it going to happen so we can get this on record that you have withdrawn from the community of color, the one that was already beset with the issues that are killing us in the first place? How fast?
Thanks, Richard. I'm going to let Mike take the first part, and I know there was also a question regarding the testing sites, and so we're going to cover that one as well.
Richard, first of all, thank you for joining us today, and I appreciate your comments. And I think this pandemic is but is laying bare all of the conditions that have affected all people of color. We could go back several decades, but in light of where we are right now, I'm going to embrace this moment and do what we can, where we can, and to the best that we can. And that means continually looking at and monitoring the situation so that when we can bring these other temporary clinics that have been temporarily closed back online, we absolutely want to do that. And, we already talked about getting additional testing sites out there, drive-through testing sites. I won't belabor that point. But I think, under the guise of doing the best that we can, where we can, when we can, that's one of the reasons why we quickly moved to allow telehealth, and you're seeing the uptake on that increasing, but also to allow people to enroll in healthcare programs over the phone. And so we've done everything that we can to this point, and we're going to keep looking and doing better to be able to connect with communities that historically have been disenfranchised, forgotten, marginalized. And I think you raised some very good points about what is happening to the African-American population, but also the Latino population, immigrant populations. And it's just an all-out effort to make sure we're doing what we can, when we can, where we can.
No. I understand what you're saying. What you're saying is we're going to get to you eventually. I said,
no, I'm not saying that, Richard.
For the community that's already in trouble right now. We've already been in trouble. We have less, and you've taken the little bit you gave us away already. So the question is, why is it the very first moment that you got in the game of saying this is going to be a problem. Let's withdraw and make sure that the white community has everything it needs and leave them out there hanging, and we'll give them whatever crumbs we got left. That's the opposite of what should have happened. So I'm telling you right now, there are going to be dead bodies when this thing is all over with. How fast can you get back to us what we already had and then over-serve us, over-supply us, over-source us because we have been under on everything else? That's the issue with
Richard, we've put resources and programs in the field, and we're going to continue to do that today. We've already done that. We're going to continue to do that. It's not eventually, it's what we're doing today. And is it ideal? Absolutely not in the light of a pandemic emergency, but we're going to keep working at this. And I completely understand what you're saying.
Matt, can you talk, there was a question about when will we know about the testing locations, the drive-up testing sites in Eastern Travis County? I know your team is meeting and has been meeting all day today to talk about logistics, but could you just give people on this call and part of this meeting an idea of when more information will be coming?
Yes, I think by the end of this week at the latest, we'll have a plan that we're able to communicate. We are, as you mentioned, Ted, meeting today. After we jump off this, I'm going to engage with that team to get an update and see where we are. So we hope in the next few days we'll be able to have a plan that we can communicate out to folks. We are looking at and would like to be able to utilize the school grounds if possible, in the parking lots or the drive-throughs, if those are available for us to use, given that they're located within these communities and kind of central to those communities. So probably by the end of this week, Ted, I'll be able to have something that we can share with folks.
Thank you, Matt. I also see a question asking if, we mentioned early on that Austin Public Health is our local public health authority. And so we are working very closely with Austin Public Health and Travis County regarding information, messaging, etc. That's the place to go for the most up-to-date information regarding COVID, exposures, etc. And we have linked the Austin Public Health website to our websites to make it as simple or as easy as possible.
I have a question.
Please go ahead.
Hi, this is Savannah Woody. So regarding communication, I know a lot of the stuff that you guys spoke about today was online. We have a lot of community members that don't have access to the internet, and I brought this up to Yvonne a couple of days ago that it would be great if you guys could send out some type of mail bulk information
Yeah, great
to
point.
the community.
Great point, and we do, and and Yvonne Davila is on the line with us. We have plans to do direct mail. We realize that not people don't have access to the internet, and so we have been making phone calls. But I want to bring Yvonne in to talk a little bit more about some of the plans that we have for community outreach.
Thank you, Ted. And yes, Susanna, so we are working on the direct mail piece that we were talking about during our call Monday evening. And I want to bring a draft of that mail piece to you and your group on Monday evening for feedback. But I want to do it as early as Monday evening so that we can send it out as quickly as mid next week. And that'll be the first one. We hope to do more than that.
Mike, did you have something to add?
No, not at this time.
Okay. I also want to mention we are coming close to the hour. We are doing this community conversation, virtual community conversation in Spanish at noon. And so, Yvonne, if people wanted to go from here to the Spanish site, can you explain how they do that to the Spanish conversation?
Yes, I'm happy to share the information via the chat box. But it's essentially a similar process. It's just a different dial-in information. I'm going to share that the chat box.
Okay. I also want to share, if you have questions that either you haven't chatted or been able to answer over the phone, if you go to centralhealth.net and then click on Contact Us, you'll be signed up for all correspondence that we send out moving forward. So centralhealth.net, contact us. I think we have another caller on the phone as well. *69.
Hello?
Yes.
Hello?
Yes, we hear you.
This is Tony. I am a resident of Birdall Farms in Del Valley, Texas, and I want to get back to the issue of the healthcare provision of healthcare disparity that Mr. Franklin brought up. You mentioned that you don't know your target limits on your personal protective equipment at this point. When will you develop that? And where are you in the pipeline of all the personal protective equipment that the president has been saying he's sending out to everybody? The N95s and the face shields, the gowns, the rubber gloves, the hand sanitizers, and all the other PPE that you're saying you need in order to reopen these clinics out in these rural areas, particularly out here in Del Valley, where we have 3 major communities with Birdall Farms, Los Cielos, and Lexington Park. And the high school is right here. If you need a place to come park, I would suggest you contact them. So I have multiple questions. Where are you in the pipeline for the PPE? When do you will have the thresholds to be met? And when will you be able to start up, open up these clinics again?
So good questions there. The first one, where are we in the pipeline? You know, to be honest, I don't know where we are in the pipeline. We're currently going through our existing suppliers, as well as working with the Emergency Operations Center and APH. So we are plugged into the areas that I feel like we need to be plugged into, but I couldn't tell you if we're first or if we're last on that list. But we're working every avenue we can to try and get more PPE coming. That's coming to our community. The second question, was there a comment?
No, go ahead.
The second question that you asked, which was, when do we think we will have what those limits are in terms of what thresholds we need to have in terms of PPE in order to be able to reopen those sites. Right now, the team is working on it, and I haven't had an update today in terms of where they stand or what they think their timing is. So I don't feel like I could give you an answer in terms of what that would be. And then the final one of when we'll reopen those sites is all dependent on when we hit those thresholds and what those thresholds are.
And Matt, there's another.
Okay, thank you. Can you also tell me whether or not you've been in contact with the independent school district out here in Del Valley?
We have. Yes, we have.
Okay.
Hey, Matt, we have a question too, and I think it's worth going back to talk about testing. So we've talked about expanding and adding additional drive-up testing locations in Eastern Travis County, but back to what's available now at the Hancock Testing Center. Will you just repeat that process? And I think I understand from you that that you're not at capacity, so there's still available tests, but would you just re-explain where to get tested, who can get tested, and again, we want to emphasize that there is no charge for this test.
Sure, and Ted, on the chat box, I saw someone talk about how some folks have not been tested or been turned away, and want to let folks know that this has been an evolving process based on the availability of tests. And so if someone went last week or even earlier this week, the testing criteria may be different because that changes based on availability of tests and recommendations from the CDC and the guidelines for testing. But the process is this is at our Hancock location. It's in the parking lot, so folks drive up. It's at the corner of 41st and I-35. They can drive up, they'll be greeted by a nurse who will then do some initial screening questions. Right now, those questions involve whether or not they're experiencing any of the COVID symptoms, whether or not they have a known exposure, if they fall in high risk of healthcare workers or group home settings, et cetera. And from there, they'll then be directed on to another kind of pathway. And if they are deemed eligible for a test, then they will drive up, they'll be able to remain in their car, and then they'll administer the test while the individual is sitting in their car.
Okay. And I know we've given a lot of phone numbers out today, and we're almost at the end of our time, and we've got to end this meeting so we can begin the virtual community conversation in Spanish. But Matt, just quickly, the number to call for the COVID hotline and the number to call for community care patients if they're interested, if they need a medical appointment by phone.
Sure. The COVID hotline is 512-978-8775. That's for uninsured folks in our community who may be experiencing COVID-like symptoms, or folks who are not established with a medical home. They can call that number and then get information and directed to Hancock if they are experiencing symptoms. The number to call for a medical appointment is 512-978-9015. And Ted, you mentioned that's for community care patients, absolutely, but this is also if folks are unestablished, we are able to do established care appointments and acute care appointments for folks who may not have been connected to a primary care home previously. So that 978-9015 number is for folks who need access to medical care.
And I also want to give one more number, which is for the medical access program. So please call 512-978-8130 and learn more about the medical access program if you don't have health insurance or health coverage, or if you've been recently unemployed or without income as a result of COVID-19. We are going to wrap up for now. We could go on for another hour, and we plan to do more of these in the future. Thank you so much for being with us. And I would encourage you to please visit centralhealth.net. All of this information is available on our website. And as soon as we know more about the new drive-up testing sites in Eastern Travis County, we will get that information out to everybody immediately. So thank you so much for your time. Stay home and stay safe, everybody.
Thank you.